am going to review an anaphylactic reaction or anaphylactic shock because both could happen. So the pathology of anaphylaxis is something, a trigger. It could be food, it could be drugs, it could be iodine dye. So this trigger, whatever it is, causes mast cells to lyse and release histamine. Okay, so histamine causes dilation of small blood vessels and capillary permeability. So that means the fluid in the bloodstream is going to leak into the tissues. Okay, so that's going to drop their blood pressure, right? There's going to be pooling of blood because the blood vessels vasodilate. Okay, so anytime blood vessels vasodilate, the blood is going to pool, which means pooling, like it just sits there. Okay, they could develop circulatory collapse and shock, which means that they could go into cardiac arrest. So we want to prevent that. Okay, so recognizing the signs and symptoms. Say you give your patient a medication and they start having hives, right? You might think to yourself, oh, they could be having an anaphylactic reaction. So it's an allergic type of reaction. They could develop angioedema. Angioedema, that's a broad term that means swelling underneath the skin. They could develop wheals. Wheals are like a big mosquito bite. That's what they look like. So be looking for those. They'll have tachycardia, but their pulse is going to have a decreased amplitude, meaning a weak and thready pulse, but tachycardia. They'll have hypotension with a narrowed pulse pressure. A narrowed pulse pressure refers to the systolic and diastolic becoming more close together. So it narrows, okay? Bronchoconstriction, which we worry about because it's going to cause wheezing and it can cut off the airway. So we want to maintain a patent airway always. The patient could start wheezing and they may complain of itchy skin. Okay, complication is shock and death. So we want to prevent that. And the diagnosis is made on the signs and symptoms I just talked about. So the risk factors are patients with allergies. So when a nurse is taking an admission assessment, they always ask about, of course, drug and herbal medications and if they have any allergies to drugs. And then they always ask about food allergies as well. So some of the most common allergies are drugs, insects, so bees and fire ants, and shellfish. Now, if somebody has an allergy to shellfish, they may also be, or they are allergic to iodine. And iodine is a dye that is used in a lot of diagnostic tests, like say they're going for a CAT scan. Okay, so they may be allergic to it. So you have to alert the provider that they're allergic to shellfish because they may need some prophylactic medication before they have it. I'll give you an example. When I worked in the cardiac cath lab, if we had somebody that was allergic to shellfish, we gave IV Solumedrol and IV Benadryl before we did the cardiac cath to prevent them from having a reaction. Okay, treatment. Number one, you want to maintain a patent airway. So you're going to put oxygen on the patient. If the patient's blood pressure is okay, you can lift the head of the bed because that helps them breathe better. But anybody with a low blood pressure, you're probably going to be giving fluids and drugs that will increase the blood pressure. And I'm going to talk about that in just a minute. Epinephrine is a great drug. It opens the bronchial tubes. It increases the blood pressure and improves cardiac output. Okay, that you could be giving antihistamines and, of course, mental health support. So if your patient is having a reaction, you're going to stay at the bedside, stay with your patient, make sure they remain calm, and call out for help. Now I need to talk about epinephrine. Now listen carefully. Epinephrine is only given IV during a cardiac arrest. Okay, that's very important for you to know. Okay, it can be given IM, it can be given SC for allergic reactions, like if somebody just had an allergic reaction and they have like hives or itching, you could give that SC. It can be given by endotracheal tube. So it can also be given in nebulizers, and we call that racemic epinephrine. But you only give IV push if the patient is in full cardiac arrest. Otherwise, you're going to give it by one of the other routes of administration. Patient teaching, very important. Patients should know their allergies. Like my niece is allergic to tree nuts, and when she told me that, I said, "Well, what are tree nuts?" Because I had no idea which nuts were tree nuts. And she was able to list all the tree nuts for me, and she was only like 6 years old. So teach the patients need to be taught young what their allergies are and to share with everybody. You're going to have to teach them how to carry an EpiPen if that's indicated in the EpiPen use, how to use it, and everybody with allergies should be wearing a Medi Alert jewelry to warn people in case they do pass out. We can tell what their allergies are. Okay, that's it for anaphylaxis.